I would encourage you to have assigned a dedicated hygiene scheduling coordinator. That person is your dedicated hygiene scheduling coordinator. Now, that individual may have many other duties that they do, but I want to have one person responsible for the hygiene schedule. If you have multiple people that work on your hygiene schedule, which is what I often see in client offices, what that means is we don't have any accountability. We don't have any ownership. And sometimes what can happen is when everybody does it,
nobody does
it. It doesn't happen. So having a dedicated hygiene scheduling coordinator, and let that hygiene scheduling coordinator know with clear communication from you that, we're going to do a review for you every year like we do for all of our team members. And the number one way we're going to evaluate your performance in the practice is your success at filling the hygiene department, your success at filling it to 92% or above. And if you do everything else well in the practice, but you fail at that number one priority, you're not going to get a good review. That's a degree of clarity that you have to have with that. Let them know that. Set them up for success. Number two, and by the way, a subset of the first tip, have a dedicated hygiene scheduling coordinator. I would suggest having an individual bonus designed for that hygiene scheduling coordinator. And here's how that might work. That if your hygiene scheduling coordinator reaches 92% or above, you provide X amount in a monthly bonus. And you can decide what that is, based on your budget and your practice. In my client offices, we'll recommend somewhere between, 200 could be a good number. It could be 250 a month. So if you're at 92% or above, let's say you're going to get a $250 bonus. Now, you can make it more interesting by having a second tier. And that is that if you reach 95% or above, we'll double that bonus amount. In the case of the 250, we'll double it to 500. By the way, it wouldn't take much math for you to figure out that if you could get to 92%, how much additional revenue your practice would have. This bonus pays for itself. And the difference between 92 and 95%, that bonus will flat out pay for itself. Now, Naren, I've got a team member that is as motivated about getting that goal done as we are as a practice, because that person's motivated for themselves. Does that make sense?
Absolutely, Gary. Absolutely.
All right. Second tip, set positive patient expectations about the importance of keeping their appointments. And the way I like to do that is at the end, at some point during the first visit to the office, I would like one of your team members to sit down with the patient and say something like this: Naren, we sure appreciate you choosing our office for your dental care. And we're going to work really hard to provide you the highest quality dentistry and make every visit a positive experience like today. And I want to share with you before you leave today 4 things you can expect as an active patient in our practice. Would it be okay if I did that, Naren?
Yes.
I'm going to give you 4 things. So number 1, we're going to treat you like we would a family member or loved one. Now, because of that, number 2, we're going to use the highest quality materials, the best resources, the latest advances, because that's what we would expect if we're a patient. Number 3, we stand behind our work. If something isn't right, we redo it until it meets our standards. And number 4, we have a protocol for you to reach our doctors after hours if needed, and we hand them a card with that protocol. Now, if it's routine, just call the office and leave a message. But if after hours is any dental concern as an active patient in our practice, then you have the right to reach our doctors after hours. We would be concerned. Naren, now that I've shared with you the 4 things you can expect from us, can I take a minute and share what we expect from you?
Absolutely.
Just one thing. Naren, we ask that if you make an appointment, you show up. No. We are family people. We understand that life, gets hectic sometimes. Stuff happens. We understand stuff happens. In fact, Naren, I saw a bumper sticker the other day that said stuff happens. Well, it didn't say stuff. It did start with an S, but it didn't say stuff. And we understand that. And if stuff does happen, Naren, all we ask is that you kindly give us 48 hours advance notice if you need to change an appointment. Naren, does that sound fair to you?
That sounds totally fair.
Now, I can't guarantee you that will work 100% of the time. However, it will radically reduce the cancellation of no-shows. All I really want to do, Naren, I obviously want the patient to show up, but at a minimal expectation, I want them to give us 48 hours notice. Because if they give us 48 hours notice, there's a high likelihood we could fill that appointment. And so could our listeners. And so how I know this works is when we're sending out our confirmations for our loyal patients the sequence we use is a 7-day advance notice, then a 3-day, then a 2-day advance notice. When we send out that first notice 7 days in advance of their appointment, some patients will call and say, Carly, oh my gosh, I have a hygiene appointment next week. I got your reminder today, and I don't know what I was thinking. Next week, I'm going to be out on vacation. I wanted to call you and reschedule that appointment. And I know I had to give you 48 hours notice. And now she's calling a week in advance. Good training, wouldn't you say, Nary?
Yes.